Hello everyone, I am Dr. Sandeep Varma, consultant neurosurgeon and endoscopic spine surgeon, Pace Hospital, Hyderabad. Today, I came before you to talk about a serious issue. There are so many people with spine problems who are of the opinion that if you go to a neurosurgeon or a spine surgeon, the first treatment choice they will offer is surgery. No, it is not true. So today we will discuss in detail about what are the non-surgical options and whom we prefer surgery than non-surgical treatment. So, what will be the treatment options for spine problems? We will divide it into two patients, young people and old people. In young patients, the most common is muscle pain or myositis. Second will be arthritis, joint arthritis, and spine disc bulge. This occurs mostly due to patients who have wrong posture or prolonged sitting and who have sports injuries or gym where they lift excessive weight than their body capacity. And there are also some other young people who into physical labor. If they lift weight on the back or on the head, they will develop cervical and lumbar disc problems. But young patients, they will have an extraordinary regenerative capacity. So even for them, if they have a small disc bulge, it can regenerate, it can rehydrate, and the problem can be treated permanently without surgery. So the first treatment option which we will give is rest and painkillers, and we will advise them to change the activity which caused the pain. Second will be physiotherapy. Physiotherapy can be two types. One, exercises. Next, electrophysiotherapy. In electrophysiotherapy, we will reduce the pain using interferential therapy, TENS, shortwave, ultrasonic. If the pain is not relieving after these above two, then we will go for injections, either steroid injections or selective nerve root block, ozone therapy or radiofrequency ablation or cold ablation. Even the pain is not subsiding after above all the treatment options, then only we will advise surgery based on the condition of the patient. But in young patients, if they develop weakness or if they develop loss of urinary control or bladder control, then the first treatment option we will advise is surgery. Because the neurological deficit, once it occurs, it will be either irreversible or will be very difficult to regenerate back. So, young patients, 90 to 95% of them with pain will be treated by medical management or non-surgical therapies. Surgery will be reserved only for those people who have failed to improve after the non-surgical management or who develop neurological deficits. But there will be a subset of people who are active, such as sportsmen. They say, sir, we can't take rest for such long. I don't want to bear the pain. I don't want to take medicines for long. For them, we will advise surgery, because after surgery, the pain relief will be immediate, and with endoscopic spine surgery, they can get back to their work within next 2 to 3 days. So these are the non-surgical options which are available for young patients. So if old patients come, or about 40 years, what we will do? Old patient, the spine problems will be different. There will be degenerative. There will be multi-level disc problem. There can be small fractures in the vertebra if they have fall at home or if they lift sudden weights because of osteoporosis. So treatment differs. For them also, the first treatment plan will be non-surgical, because most of them will be having diabetes, hypertension, cardiac issues and several other comorbidities. So we will tell them to take rest, take medicine, do physiotherapy, strengthening exercises. If not, then we will go for injections or electrophysiotherapy or radiofrequency ablation, ozone therapy, nerve root block. In case of fractures, if the fracture is small and it is not compressing the spine, then we will go for a minimal invasive approach such as vertebroplasty or kyphoplasty. In those, we will inject bone cement into the bone under local anesthesia, and this will reduce the pain and further prevent the fracture from increasing. After trying all these small non-surgical therapies, if the patient is not improving, pain is not subsiding, then we will give the surgical option. But even for old patients also, if there is weakness, neurological deficit such as loss loss of sensation in the leg, loss of urine control, loss of bowel control. They are not able to walk. They are not able to hold chappals. They are difficulty in climbing stairs, or if they are not able to walk long. If these neurological symptoms present, then we will advise surgery if the patient is fit for anesthesia and surgery. So, don't be afraid. Don't delay the treatment. If you are in starting stages only, consult a neurosurgeon or a spine surgeon, get a good treatment so that we can prevent you. We will protect you from going into neurological deaths. Because once the weakness occurs or once the deficit occurs, it will be very difficult to get back your previous strength. You need very long physiotherapy, months and months of physiotherapy rehabilitation. So, don't worry, don't be afraid. If you have any doubt, consult me or any neurosurgeon available. I am Dr. Sandeep Varma, consultant endoscopic spine surgeon, Pace Hospital, Hyderabad.